Hey guys, this is Pawan. I'm a registered nurse based in Sydney, Australia, and this video is all about enrolled nurses. So in this video, I'm basically going to cover what qualifications you need to become an enrolled nurse, what the entry requirements are for international students to study enrolled nursing in Australia, what the fee structure is like, and what happens upon graduation. Also, the job opportunities we have in Australia for enrolled nurses and how much do they actually earn. In the end, I'm also going to talk about the pathway for enrolled nurses to become registered nurses if they wanted to go for it. So let's get right into it. So mainly there are two different types of nurses here in Australia, enrolled nurses and registered nurses. The main differences involve the type of training they've gone for and the scope of practice. Enrolled nurses are the nurses who work under the supervision of registered nurses. However, this supervision can be direct or indirect depending on the responsibility of the enrolled nurse. Despite this supervision, enrolled nurses are responsible for their actions and fully accountable for providing nursing care. And the tasks that are delegated to enrolled nurses can vary depending on where they're working. Now let's talk about the qualifications you need. So what exactly you need to do to become an enrolled nurse here in Australia? Well, for starters, you need to enroll yourself in Diploma of Nursing course, which is typically a 1.5-year course, full-time. It's a combination of theory and practicals. The course requires a minimum of 400 hours of clinical placement for clinical skills acquisition and registration. So wherever you choose to study Diploma of Nursing, be it TAFE or university, they will organize these clinical placements for you, where you go to different health facilities like aged care settings or hospitals to gain some clinical experience under supervision. And these clinical placements are typically held from Monday to Friday. So the entry requirements for international students. Well, firstly, you should have completed your senior secondary education, which means you should have passed your Year 12 examinations. And secondly, the English score. Well, the current requirement is a score of 7 in IELTS in all the components of the test. But that can vary for different universities. So make sure you check the selection criteria for each university you are doing the research for clearly and see which one suits the best for you. And you don't actually have to go for IELTS. You can go for other tests like OET and PTE as well, whichever one you feel the most comfortable with. And if you want to find out which is the best English test to go for, I have linked a video in the description box below, so make sure you check that out in the end of the video. Now, how much does it actually cost to study the Diploma of Nursing here in Australia? Well, the cost can vary for different universities, but the approximate cost is about $8,000 per semester. And that's just the fee. It does not include your living and your traveling expenses. Work while studying. Once your course has commenced, you are actually allowed to work 40 hours a fortnight on your student visa when the course is in session, and unlimited hours during the semester breaks. Now, clinical placements that you go for as a part of your course are actually not included in these 40 hours because that's not paid work. Now, let's talk about registration. So once you've completed all the required components of your course, you can apply to the Nursing and Midwifery Board of Australia to get registered as an enrolled nurse to practice here in Australia. Now, the registration costs about $180 Australian dollars, and you have to renew it every year. Now, before we get right into how much do enrolled nurses earn in Australia, let's look at some of the job opportunities we have for enrolled nurses in the country. Well, enrolled nurses can work in a wide range of clinical specialties and environments. They are employed in a variety of healthcare settings, including public and private hospitals, rehab centers, community healthcare centers and disability services, and also the mental healthcare services and rural health services as well. So basically, they can work in any healthcare facilities where a registered nurse would work as well. Now, how much do enrolled nurses earn in Australia? Well, the current pay rate per hour is sitting around $29, but it can vary depending on which health facility you're working in. And also, obviously, what kind of shifts you're working. If you're working more afternoon or night duties, you would be obviously paid more than a morning shift. So stuff like that. Because I've got a friend who recently graduated from Diploma of Nursing, and she was earning about $29.68, around about that. But she was also working in a private hospital, which was paying her a little bit more than the public hospitals. So it can vary depending on where you're working again. And also, if you're working more weekend shifts or if you're working more public holiday shifts, then you would obviously getting paid the penalty rates as well. which can, take your rate up to, I'm not gonna vouch on this, but it can take your rate from $29, let's say, to $39 or something like that. Based on my friend's feedback who is working as an enrolled nurse, I just want to say that I think they are paid a decent amount of money. I mean, looking at the type of training they've gone through and the scope of practice, I think it's a pretty decent amount. Now, there are many enrolled nurses I work with who have chosen to go back to uni to study to become a registered nurse. It's totally optional, obviously, but it's another 2 years of study, and you can keep working as an enrolled nurse while you're studying at the same time. But for my fellow international students, once you've graduated from Diploma of Nursing, I would say don't go back to uni and study to become a RN straight away, because obviously it's going to cost you a lot more as an international student. So wait to sort out your permanent residency first, and once that's all sorted out, you can choose to go back to study to become a registered nurse, because it's a lot cheaper as a domestic student. And for those of you who are struggling to find the best university to study nursing, you might want to check this video out. So guys, I hope you found this video useful. If you did, please give it a thumbs up. And if you like the kind of content I post on this channel, please hit that subscribe button, and I'll see you in the next video. Bye.